Let's get it going. Salam and hello, friends. Welcome to Uproot. My name is Lily Bakala Piper, and it is Saturday morning here in Nairobi, Kenya, and we are continuing to live through this global pandemic of the coronavirus. I'm sure many of us now are settling into new normals, new work and living situations that are causing unique situations for each of us to consider. But if you are a woman, surely balancing life and home and closer quarters with higher demands is nothing new. So on today's episode, we want to explore a side of this COVID-19 pandemic in a different way and really think about what its effect has been on women and girls, essentially the patriarchy of the pandemic. And today I'm really happy to have my friend Julie Mwabe with me. Julie is a communications strategist and Julie is a leading communication strategies for development and public health expert, and currently she serves as a gender advisor at the Executive Office of the President of Kenya. Prior to her role in the government of Kenya, she was a communications specialist at the CDC here in Kenya and held a similar role at UNICEF prior to the CDC. During her career, she has conceptualized and delivered a range of strategies and campaigns that have led to increased outcomes and opportunities for women and children, particularly in the areas of HIV/AIDS, maternal health, gender equity, and broader child protection issues. She is passionate about redefining the narrative for women and girls. Julie is a Nairobian, born and bred, and lives here with her family, and she wanted me to say a very handsome 3-year-old son. So welcome to Uproot, Julie. I'm so glad you're here.
Thank you, Lily. Happy to be here.
So Julie and I met because we were both attending a function of all women professionals here in Kenya to celebrate a colleague who is moving on to a new post. And we were fortunate to sit at a table with, I think, about 7 or 8 other women. And it was one of those experiences where we just immediately started talking about work and family and life. And before you know it, 3 or 4 hours had passed and many stories and laughter had been shared. And we have kept in touch since then. And I am so grateful that both for your service to Kenya. Thank you. You are a public servant and we are grateful for your leadership. But I'm also grateful for your friendship. So thank you for being here on Uproot today. So Julie, we have probably all seen these memes going around talking about, if you are fortunate enough to work from home, then perhaps you'll be the next Shakespeare and write King Lear, or you'll be the next Isaac Newton and discover, a new scientific theory. And the response to those memes from some of the feminist communities has been, well, Shakespeare and Newton did not have childcare responsibilities. So no, that's not happening. We are going to just do our best to make it through. And I think it's a poignant point. And I think that's why this conversation feels really important to me today, which is to talk about what are we starting to see as the effect of COVID-19, specifically on women and girls. How do you see it from your position currently, and also just generally as you're looking out at the landscape of how the world's response has been to this virus?
Sure. Lily, yes, it is, I know there's all the memes about working from home, but the reality is not everybody can afford to work from home. So you have, economies, for example, Kenya, where such a large percentage depend on the informal care. So they're your cleaners, they're caregivers, they're cashiers, they work in the restaurants. So a lot of these, they're all of a sudden out of work, and a lot of their families depend on them. So loss of income, going home, there's a strain of being at home, the stress, and we're seeing more violence cases, domestic violence, increasing. Then you have the healthcare. We have sort of 70% of the health force is women. So that means they are more exposed. So you have your nurses, your midwives, they are more exposed to getting sick or being infected. Right. And they're the same people who still have to go back home and look after their families and their children. And you also have even, the girls who are now not in school anymore, what's happening there? They're being exposed to, the teenage pregnancies are likely to start rising because we saw those during the Ebola crisis as well. So there's a lot of that we're beginning to see.
So
and affecting it's definitely affecting. I mean, it affects men more, as a physical illness. So the numbers show that the men are getting more, but then the impact on women is also vast and high.
You mentioned a lot of things in your response. So let's maybe try and break some of those down and disaggregate some of the issues one by one. Let's maybe start with employment, because this lockdown is certainly creating an economic pandemic, if you will, for everybody across the globe. No country will be immune from the economic fallout of COVID-19. Of course, your expertise is here in Kenya, but I think we can extrapolate that experience broadly. How do you see COVID-19 really affecting women in particular in regards to economic outcomes? Let's start there. What are you seeing as the first line or the first kind of wave maybe of this economic fallout?
So first wave of line, you have the loss of income, and then there's some countries that they're beginning to sort of support their citizens, and the tax, something like a tax cut will not work for somebody who's an informal, who depends on the daily wage, right?
Right.
That doesn't work for them. So you have a lot of people who are already quickly getting into this desperate situations, and for them it goes to no food, not able to feed their families. So the economic impact is very quick and very hard on them in that way.
Yeah. So we have informal daily laborers who are, by these stay-at-home orders or curfews or other measures, are losing income immediately. Not savings, not investments, but immediate day-to-day being able to function is loss. Do we have a sense in the region of women, what percentage of that workforce is compromised of women? I know I can just think about my community immediately, and I think about the lady down the road who sells baskets, mostly to tourists, these beautiful baskets that are very Kenyan in nature. And I just have been wondering about her, this week, just as an example. Is she selling anything? I have people who work in my home, and I wonder how many of their colleagues have now found themselves in a place where they don't have employment anymore.
Yeah.
Your thoughts?
So we have, for Kenya, for example, it's 70% of, women are low wage earners, right? Mm-hmm. And then you go to the flower industry, you have that's 75% of women there. And, you go into a market, it's 83%, the women who sell and trade. So the percentages for women who rely on the informal sector are really high.
So something for all of us, I think, to be aware of if we have any if we are employing women on any scale, on any level. I've seen people responding different ways on social media. Some people saying, as long as I have a job, if I'm employing women, I will continue to employ them, or whoever it is, women or men. But then pretty immediately though, if I lose my source of income, then also my ability to keep my sister employed now becomes, very unlikely. In light of women potentially losing these jobs and these daily wages, what are we looking at 1 month, 2 months, 3 months down the road as a result of these economic losses?
Well, I think, the projections right now are not looking really good. I know different governments are trying different ways of cushioning the citizens. There's a cash transfer program where they try, sort of under the social protection mechanism, trying to find ways of giving a certain amount of money to just keep them floating. So there are some ideas that are in place, and different countries are doing it in a different way. But I think the reality and what is getting clear is the most vulnerable are going to be hit the hardest, and they really put front and center of this crisis and how to mitigate it, and just how to sort of make sure that they remain looked after really as best as possible. Yeah.
So we know that for women who are fortunate to work from home, which especially in Kenyan context is a minority, a very small minority. As you've already stated very clearly, women in Kenya in particular are at the front lines of many industries who will not have the option of working from home. But for those that do, there's this concept of having a second shift under normal circumstances where you would leave home in the morning, go to your work, no matter what your work is, informal or formal, come home, and then you have your second shift begins of caring for your home, for your family. In this season now, where many of us are indoors all day with our family and are caring for them all day long, it's no longer disaggregated into morning and evening shift, it's just all day. What are some of the messages that you think that employers need to understand about the women on their workforces and the tasks that they're facing under this pandemic?
Even before the key messages, you know, what we're seeing, or, you know, even across the world, you have, you know, maybe a couple and they both earn and now one has to stay home. Usually it's the person who's earning less, you know, will probably give up what they're doing. And so the women will stay home, and sometimes a man can continue working. So I think the message would be, find a way of just keeping them, you know, embrace flexible working hours, be and uh,
Oh, Julie, I'm just going to ask you to pause just there for a moment. Could you go back after what you were just talking about, flexible working hours? Could you start from there again? I think the internet went out on me for just a moment. Just if you could just start from, okay, some things to consider are flexible working hours from there.
So, I mean, as an employer, I'd say, you know, please be considerate of uh, your employee. The reality is they're balancing so much, you know, trying to be both teacher, caregiver, and their family. So things like flexible hours, being more flexible to the timings. I know that it may not be 9 to 5 online in front of a laptop, but you may be able to put in some work when your children are asleep or early in the mornings, or just whatever works for your family. So being open to that kind of thing. And then when I think being sort of flexible when it comes to letting people go, if you can just, I understand pay cuts are happening, but I also see like a lot of people who are on the lower scale are the ones who are being pushed out first, you know? So you'd be like, you know what, the cleaner is not coming to work because we're not going to the office, so we don't need her anymore. The person who's making your tea or doing all these things we don't need. So we get very fast to sort of cut them off, even though they don't have as much of a bigger impact. So in terms of your, you know, the economic levels, I mean, how much money is being spent, right? Because they're likely the least, right? So how do you still cushion them, even if it's a cut across the board, and not just letting go of people because they're not coming to a physical space?
Yeah. I hear one thing I'm hearing from what you're saying is trying to, in a time where we're all having to think outside the box a bit and be more creative about how to work, maybe also thinking about instead of just cutting people off, thinking about, is there another fit for them within our company's new scheme? And so if it's somebody who made the tea, or is there another way to think about offering them opportunities during this time without just doing the usual and start cutting, because that's what everyone is doing at this time. That's not easy. We recognize that there are challenges in that, but the reason why this is so important goes to your first response, that when women start to lose employment, when women start to lose wages, there is a domino effect to the family, and then ultimately to society and to the country. And so trying to do everything we can to cushion, like you said, their well-being during this time is going to be really crucial to our long-term outcomes.
Yeah, and it's easy to have a business approach to this kind of things, but I think my encouragement is have a human approach, you know, look at it, have some heart into it, put some heart, and just see, like, you know, these are families, these are lives really, you know, they're being exposed to other things that you may not be aware of, but it's going to affect them in the long term.
Yeah, absolutely.
And when it comes to us bouncing back, you know, the person who'd be bouncing back would be so different from the person who you left because of all the issues they've had to go through because of the crisis.
Yes, that's a very good point, that at the end of this, nobody will be unaffected, nobody will be the same. And so if we want to come back and have a workforce that wants to come back to work, it really matters how we treat people now in this season. Julie, in your first response, you talked a little bit, you referenced the Ebola crisis of the kind of I don't know, we call the 2010s, I guess, the 2010s. What did we learn from Ebola crisis, from other global health crises that we should be implementing now when it comes to women's health specifically? Let's talk a little bit about the women's health. You've mentioned, my previous guest, Dr. Chung, also talked about that men, as it turns out, their response to the coronavirus are not faring as well as women. Some of their outcomes are significantly worse than women. But the other side of that conversation is that, as you've mentioned already, women are a majority. Up to 70% of health workers are women. Women in these informal sectors around food and sanitation are women as well. So let's talk about the health of women in this pandemic, and what are the things that we should learn or can learn from previous global health crises?
So, um, I mean, one of the things that has come out that I've been reading about is during the Ebola crisis, you had, by the end of it, the number of women who had died due to childbirth complications were higher than the people who had actually died of Ebola. So the reality is, even in the middle of a pandemic as big as this, there are things like, for example, Kenya right now, we have a curfew, right? So
Right.
we all have to be home by 7 p.m. There's a lockdown. I mean, there's the curfew for now, and other countries have full lockdowns. Um, what happens if somebody, uh, a pregnant woman needs to go to the hospital in the middle of the night? They're scared of going. They don't have access to antenatal care during their pregnancies. So you're having a lot of, women who are, just falling through the cracks in that way. Um, and when you talked about the sanitary hygiene, how do they access this? Like before, there were systems. Maybe it's a school system. You go into a school, and the matron in school is able to give you sanitary pads. But then now you're home, and you're all in one confined space. Asking for things like sanitary pads seems like a luxury for some families. So there are women and girls who are not able to access those anymore. And you have, if you look at adolescent girls who have, HIV, and they're trying to get their treatment, and they can't access those anymore. So you have a lot of health outcomes that are likely to sort of start going down while all the focus is on the crisis, right? So I
Wow.
think my message in this was like, how do we find a way of balancing that? As much as all eyes on the crisis, the other health functions are still working. There's a mechanism to ensure that women and girls are still being able to access health services, whether it's maternal health care, whether it's the family planning, whether it's just the sanitary pads as well. So all that. I mean, there's a lot of that it almost feels like they're all currently on pause,
Yeah, right, right.
thinking is here. But the reality is, you could come out of this crisis, and the outcomes on that are worse.
And at the end of this show, I will be shouting out some organizations that are specifically thinking about sanitary pad distribution during this time and how to support those girls. But you mentioned a number of things, both affecting everything from girls to women. So we've learned from Ebola that maternal outcomes, shockingly, were worse than the Ebola outcomes for women. More women were dying of complications because now those resources that would have been allocated to their well-being are now being diverted to the well-being of Ebola patients, or were during the 2010s. And in the United States, I think we see similar data around especially Black women's health, that Black women are twice as likely to die in childbirth than white women in the United States. And during this global pandemic, we know that resources that might have been targeting those vulnerable communities or more vulnerable women are now being diverted to respond to this pandemic, which is going to mean maternal mortality is likely to go up during this time, which is a heartbreaking outcome that I don't think is on many of our minds. I think so many of us are thinking about the immediate day to day, like today's, school is closed this week and XYZ, but there are so many other domino effects of this pandemic. For girls and menstruation, particularly in our part of the world, there's also this issue of toilets, right? And access to toilets. In many informal communities, informal settlements, the ratio of people to toilets can be 50 to 1, to 100 to 1. I've heard thousands to 1 in some communities. Julie, what are the things that we as citizens and people who share the same community how can we best respond to some of these situations? It feels overwhelming to think about.
Yeah. When it comes to the sanitation situation, when things are normal, when during better days, you have uh, not as many people crammed in once. I mean, they usually it's already tough, but because of schools, a lot of girls are now in school, and they're able to access some of those, um, amenities, and they're able to get the pads and able to use, and they're able to even have the education around it, right?
Right.
But then now when they're back home, confined, quarantined, and there's a toilet, and like you said, 1 to 50 or 1 to 100, already in that space, you can imagine what they're being exposed to. Number one,
Yeah.
how do you ask for a sanitary pad at this point? They're like, of all the things, it's such a, it's, they're not able to access that in terms of their own health, in terms of their own security, being able to go to this. I mean, it's not like there's a female toilet and a male toilet, it's just a toilet. You go if it's early in the morning or late at night. So I think I'm beginning to see people rally around, think about dignity kits, where you have some soap, a sanitary pad, a little underwear, and being able to sort of put packages together with dry foods and sort of being able to give families, or finding ways of engaging girls and still giving them that kind of thing. So I know the hard thing about this kind of thing is the social distancing. So when you go into such communities, how do you sort of have where you're able to even give this packs and still maintain social distancing, and who are you working with? Are you allowed? There's all this nuances and questions. However, for those interested, we're happy to think through how to work some dynamics around it and sort of create mechanisms at work.
Yeah, I saw that this week, and forgive me, I can't remember if it's Kenya specifically, but one country in the region, if not Kenya, pastors were asking to be considered essential workers in some of these curfew situations, because we might have to look at different ways to distribute sanitary pads in the absence of school programs that may have done it before. We might have to look at creative ways. Maybe churches will be one place, but I will certainly at the end of this episode link to places that are working already in informal settlements, who are places where we can contribute money in the very least. But I would say, I think to most of my listeners who are in a position where they are employing people, where they have some influence, be it small or large, to consider keeping women employed as much as possible, even if they no longer need their services, keeping them on some kind of pension or something, so that we know, because we know that if women continue to receive the cash transfers or access to some kind of monies, that money is going to be used to serve their families. I mean, I think research shows us that as well, is that they're much more inclined to make sure that the family's needs are being met, whether it's maternal health or sanitary.
Yeah, and one of the things that in our work we've been really talking about is, when you have that cash transfer program, when you're able to give it to a family, do you give it to a man or do you give it to a woman? Mm-hmm. A lot of households are female-headed households, even as much as they still have a man in their house. But then, like you said, looking at history and looking at the data and seeing how men and women spend the money differently when it comes in such situations.
Yeah. And I just, as we're talking, I'm just struck again how hard this is. I mean, it's not easy. There's no easy answer that we can point to and say, oh, if we just do this, there we go. We can definitely take care of women and girls 100%. It is so hard. I mean, I myself, as somebody who wanted to engage on this issue, find it really hard to know the best way to go about being responsive to the patriarchal part of this pandemic, really,
Yeah, and the way I've been trying to explain it, it's like an airplane that's taken off and you're trying to fuel mid-air, because we're all trying to figure it out as we go. And I mean, on one hand, I've seen, for me who's part in public service, and I've seen the best of government in the last few weeks, and I've seen how people are rallying around and trying to really see and understand and listen to each other. So being able to even talk about the gender issues, the women and girls, and you get a lot of people saying, oh, wow, I never thought of that. I never thought that, they experience certain things differently, So you're right. I mean, it's just talking about it is a big part of it.
Absolutely.
Because unless it's in my view, I don't know,
Absolutely. Yeah, I'm reminded of the patron saint of Uproot, Wangari Maathai, who says, do your little thing, right? So our little thing right now is maybe just raising the alarm, asking people to consider, if you're an employer, if you're an employee, if you're a person in a neighborhood, how are the women around you faring? To stop today and think about, how are the women that I pass every day on the way to work, who I used to stop and buy fruit from or whatever, is she still there? Is she able to work? What has happened to her? And just like you said, to raise it as something for all of us to consider as we're thinking about our own families, getting the food we need for this week, or managing our children's school, to also be thinking about the other women in our community. It's very easy to be, yeah.
And you let whether it's somebody who was helping out in your house or a nanny, you let
Yes.
that where me and my family, we need to be isolated. But you know what? They're your family too. They're your community. You'll be out of this. You will need them. And just being able to sort of, how can you, even if they're not coming into your house anymore, how are you able to still check in on them? How are you still able to support them? And how are you still able to ensure that collectively we sort of all pull through?
Absolutely. So I hope this doesn't sound self-important, but one thing that crossed my mind this week is that, we used to get our hair done regularly. This is why I'm in this thing now, because it's not happening regularly anymore. And, I did think about the amazing women who have been doing my hair for many, many years, and just sent them something small this week, 1,000 bob, 2,000 bob. And the messages I got back from them, I won't be able to, these were not like, this is not deposit on future. It's just like, I was thinking of you. I have this margin I can share. Let me share it. The messages I got back, they were like in tears. Like, thank you so much for just thinking of us. And it is, I don't have any access to the UN or other government agencies, but I do have these few people who have been a part of my daily life. And so if there are people whose services you were using before, laundry services or cooking services or hair service, whatever it is, these small, roles, they are likely completely without income right now. And so being able to send them something small during this time, or I've seen some companies urging people to buy vouchers that can be redeemed later, that will keep those small businesses afloat. We know many, many women here in Kenya are entrepreneurs and are keeping the economy afloat and during normal times, because there are all these small side hustles, and there's some great organizations who are working to empower female entrepreneurs during this time. I'll link to them as well, because I think those are small ways that we can do too. There are a lot of organizations who are still selling products and providing services that we can support during this time, because it's not just women in these just in informal work, but middle income, low income, small entrepreneurs also need our support during this time.
Right.
Yeah, so I'll link up to those. So, Ms. Mwabe, in your role as a gender advisor in the Office of the President, Executive Office of the President of Kenya, from where you sit, what does a feminist response to COVID-19 look like? And what do we want to see from our neighboring countries? And what would a feminist response in the continent look like to you?
Well, I mean, in the continent, you're seeing a lot of, there are a lot of press briefings at the moment. You're seeing a lot of leadership, and it's a lot of it is male, and unless we have women in those decision-making roles, unless we have them embedded into these task forces, then we still have decisions that are not including, they're not inclusive of women and women's needs. So I think being the Kenyan government, for sure, I can say, I'm there, so we have more women in sort of.
Thank you.
But then in terms of, the task force and those key decisions, I think it's just encouraging them to be more inclusive of women. And because we see things differently, we experience it daily, so we're able to ask, for example, on data, we need to be able to know how economically, how women affected differently, health-wise. So unless we have that data, the decisions cannot be made. And and I think a lot of pandemics, you end up having the data that's not sex disaggregated. So unless we're able to do that and push for those kind of things, then we'll sort of just be in a cycle and
Absolutely.
not get the need.
Absolutely. No, there was an article this week that you and I were talking about before we started recording, called The Coronavirus is a Disaster for Feminism. And one of the points that the author Helen Lewis makes, this article was in The Atlantic, she makes at the end of the article is that the data collected on the previous global health crisis either didn't include women's health, disaggregated, like you said, by gender, or it wasn't measured at all. So the rates of teenage pregnancy were not captured. You know, was there a change in that? The rates of reporting of domestic violence wasn't recorded during those specific crises. And so, like you said, here we are trying to fuel midair again during a global pandemic where women and girls are being affected disproportionately because there is not a feminist agenda at the top of organizations. And so, please.
Like, you know, being able to, like you said, get it. What are the lessons learned? What did we learn from other pandemics that we can sort of, and like you say, as much as things are already moving fast speed, what are some of those lessons? Try employ as part of the research and part of the action plans moving forward.
Absolutely. And so, you know, if we have listeners here who are part of response teams in your organizations, I think it's a worthwhile exercise to reflect. Are your policies and your responses feminist in nature? And feminist does not just mean pro-women, right? It means that we are capturing everything that would happen to women and girls as it affects a larger body of people, as it affects an entire organization and an entire ecosystem of business or education or health. Having a feminist approach does not mean it's anti-men, but that it elevates everybody's needs at equal attention, equal funding, equal response in light of this pandemic. Is that a fair definition? What would you add to that?
Yeah, I mean, that's good. I mean, I think
that's good. So make it better. Make it better.
Whenever someone, you know, you sort of say, oh, I'm working in gender, they're always like, oh, what about the boy child? You know,
yes.
Gender, you know, you sort of don't pull the gender card. And that's not what it is. It's exactly what you said. It's ensuring that everybody has access to, you know, what they need. Not one is being left behind or falling through the cracks.
Absolutely. And I mean, I think we see that, I mean, just in what's happening in Malaysia this last week, where women were told to dress up for their online work. Did you see that? And not nag their husbands. I was like, where is the message to the men to contribute equally and to participate and not nag their wives for lunch? I mean, I just was blown away by that, but this is why we still need gender advisors in the office of the president. This is why we need gender parity in response to crises, is because our implicit bias is still patriarchy. It's still towards the male. I mean, we are not in a post-gender society in any country.
No, and our responses are very gender blind. So.
Absolutely. And, you know, we were discussing this as well earlier, that there is no gender neutral policy when it comes to pandemics. We have to be gender specific. This is not the time to pretend that we all are affected the same, because we're just not, and we never are. But in particularly when there's a global crisis of this scale, we must consider the woman and the girl child very specifically in our policies and our responses.
Great.
Mm-hmm. Well, thank you. I'm touched by your agreement in that. You mentioned in your first response, and I want to make sure that we give it time here, there seems to be an uptick in the reporting of domestic violence during this time. Some countries have actually implemented a ban on the sale of alcohol. I saw that Peru has done that because they see a direct link between the consumption of alcohol and abusive patterns. So they've actually banned the sale of alcohol. And we're seeing that this quarantining, this place where government is now saying stay home, reinforces some of the abusive messages that perpetrators tell their victims, or their, let's call them survivors. Help us understand better why domestic violence is something that we all need to keep in mind when we are maybe considering where to donate and how to support and what to be aware of during this pandemic.
Well, I mean, the reality is everybody's under a lot of stress. And with that comes the pressure, the financial pressure, where you're not bringing money. Like your lady you're talking about who's doing your hair, she's not able to take that money back. I mean, probably you're doing your hair every week, every 2 weeks.
Every 10 days.
Every 10 days. You know, they're not able to take that money back home, right? And what we know about violent domestic, you know, the people, whether it's children or whether it's women, it's the people who are closest to you. And in normal circumstances, they're sort of, you know, the avenues, there are places you can go, especially like, for example, if you're planning on leaving a violent situation and you've been putting together your plan, you don't have that plan anymore, right? And like you say, there's alcohol included, there's all this factors with people just being in one space. And those numbers are surging. I mean, I've been seeing those articles, I've been seeing reports on an increase on gender-based violence. And like you said earlier, because everything is just going so fast, we haven't, most people haven't thought, oh, okay, what do we have in terms of our referral system, right? Do we have shelters in place where, you know, women can still be able to go to? I mean, what are we doing in these conditions? So, and it's the same for children, you know. The people who abuse children the most are those closest to them. On normal days, they go to school, they have a teacher who they may be able to talk to, but then now they don't. But I'll also take it further, Lily, and talk about the cyberspace, you know, cyberbullying. You have a lot of children now who are online, and unless they're being well supervised or you are in tune to it, they're getting into chat rooms, and there's a lot of things happening in that space that you may not even be aware of as a parent. So being able to be aware of these things, and keeping your eyes open. And it's not just a situation for people in low earning homes, it cuts across the board. And what do we need to, how do we support people in these situations? How do we keep the communication lines open? Are they in hotlines that are still working? That, you know, that, but that's the thing. If I call a hotline, where will you refer me to? So unless I have those referral pathways that are clear and part of the policies and not going to be communicated clearly, then it's a tough situation.
Yeah, it's overwhelming, and I think we again, one thing we can do is start with the people we know and are in our immediate sphere of influence, our immediate communities, checking in on them, their welfare, are they doing well, making sure, we provide what we can to support those we know, and then from there, seeing what structures are in place. And one thing that I'm struck by that I read this week too is that shifting a little bit from the domestic violence, but even into how it affects young people and girls specifically, is that if people are pulled out of school now, and girls are being pulled out of school now because of the government mandate, many of them won't go back in a few months when schools reopen, because families will have made a decision that, you know, this girl, let her get married, let her earn income. We've already lost this time, or she's pregnant now, and so there's the need to invest in her education seems less of a priority. Julie, help us think through that. Can you walk us through why some of those choices become particularly painful and urgent for girls and the families of girls?
I think, you know, when you think about the amount of advocacy that goes into teenage pregnancies and, you know, working with communities and families, because it's not just about the girl, it's about their parents, about the communities, and sort of getting to a place where you've convinced them to let the girl stay in school. I mean, it's a lot of work that's been put in. So they're in school, a lot of them go boarding school or day school, they're out during the day. And the minute now they're back home, you know, I think, we're talking about earlier during the Ebola crisis, you know, there's an increase of, I think, 14,000 teenage pregnancies. These are, you know, usually by their family members, those at home. And beyond that, even stuff like female genital mutilation, you know, goes into harmful practice, because people now go back to their norms, you know, their cultural norms, and sort of tend to rely on that. And like you mentioned, the early marriages, again, this is, you know, it's a point of income, you know. If someone's going to give me some money to marry off my daughter, I need the money right now. Forget all those lessons and the advocacy and all those people who've been coming and telling me that my daughter needs to be in school. This makes sense for me now. So I think we are likely to see a reverse in sort of a lot of those gains that have been made. Again, the people who suffer the most are those who are most vulnerable. It's the girls, it's the teenage girls who have no platform like this, who no one's speaking for them, they're invisible, you know, they're really falling through the cracks. So how do we ensure that, you know, the policies come into place, the mechanisms as part of the response have this in mind? How considerate of this?
And I think again, it's easy to listen to all of this and just feel like, well, I can't do anything. I'm nobody. I have no role. I have no money. I'm not a supervisor. I can't do nothing. But I hope that people listening will take all of this into thought. If you are in a position to contribute money to organizations, do so to organizations that have a feminist agenda and feminist leadership. So the leader might be a man, but he can very well be a feminist in the way he implements policy and distributes funding. As this pandemic, God willing, comes to a close sooner rather than later, and you are looking at organizations, look at those organizations who are targeting women and girls, because for sure, as you've said, Julie, they will have lost ground as a result of this pandemic. And in 6 months' time, or whenever we all come out of this, they will really need our support. They will need our support financially. They'll need our support in sharing their message. They'll need our support if we're able to volunteer time, because all of these things, like you said, they are part of a larger network of advocacy and programming that have been trying to protect girls and also change social behaviors. And we want to make sure that their gains are not lost forever. There might be a setback right now, but that we can come back in a few months' time and all of us put our hands together to support. And maybe, Julie, it'd be great to have you back actually in a few months when we have turned the corner and we're looking at, this being over, thinking about how do we now support these organizations and think about plan B, or not plan B, but the next step in this plan. How do we now help once we are all back to quote unquote normal, which I know is a loaded term right now, but I hope you'll come back then and talk to me again.
I'll be back. You're my friend.
You're my friend too. Thank you, friend. Thank you so much, Julie Mwabe. It's been a joy to have you here. And I think that's what the goal was to raise awareness for us all to be thinking about this outside of just our own little family, think about our broader community, and in particular today to think about women and girls. Thank you for the many years you've committed to women and girls and elevating us and making sure that we have what we need to thrive. Thank you.
Thank you.
Thanks for being on Uproot. See you soon, I hope. Okay.
And
that's right. That's right.
Apps on how to chat. So
exactly. Feels like we're almost together.
Yeah.
Thank you so much for being on Uproot.
Thank you. Thank you.
Okay. So I'm going to stop recording.